name is Rebecca Williamson. I'm the publisher of Fierce Healthcare, and I'm here with Dr. Omar Manejwala, the Chief Medical Officer at Catasys. Omar, thank you so much for joining me today.
Oh, it's a pleasure to be here. Thank you.
Good.
Yeah.
So get things started. Can you tell me a little bit about Catasys and the work that you're doing there?
Sure, yeah. So Catasys is a leading AI-enabled healthcare company. And what we do is we solve for the impact of untreated behavioral health conditions on chronic disease.
Okay.
Yeah, so you know how there are all these people who are getting sick medically from diabetes, congestive heart failure, all the major chronic diseases. Well, if you're not getting help for depression, anxiety, substance use disorders, other behavioral health conditions, those get a lot worse. And so then, people become sicker and it's very expensive. And, with 40 million Americans who are suffering from this, it's a huge problem that we're solving.
Tell me a little bit more about the health plan members that you all serve.
The people we serve are really suffering in silence. So there are many reasons why they don't get help for behavioral health conditions. Sometimes it's stigma or shame. Many of them don't believe they have a condition, or they may not trust the system to solve those problems. Then there are all these social and behavioral determinants of health that get in the way. Things like food insecurity, intimate partner violence, domestic violence, transportation issues, housing. So all the reasons that conspire to keep people from getting the help they so desperately need. And they're getting sick medically as a result of that. Their chronic medical conditions are getting worse. That's where we come in. Those are the members we serve.
Okay, great.
Yeah.
Now, how are you uniquely positioned to serve that specific population?
Well, we can find these members.
Okay.
So we work directly with our health plan partners. We ingest their data, and we identify people whose untreated behavioral health conditions are making them sicker medically in an impactable fashion.
Okay.
And that's done on our platform, which is called Predict, Recommend, Engage.
Okay.
So one of the key differentiators is being able to identify which members specifically are getting sicker and more expensive as a direct result of untreated behavioral health conditions. Okay. But then finding those members isn't enough. You've got to be able to identify what solutions will work for them and deploy approaches that will engage them in care.
So is this just access to care, or is it more than that?
Yeah, great question. There's no question that people with behavioral health conditions have a problem with access to care. It's hard. I mean, there's not enough providers to treat everybody, and so a lot of effort is being applied to solve that problem. It's an important problem. But this is much more than access to care. You can't just build it and they will come.
Sure.
If you provide access to behavioral health services to someone who doesn't believe they have a condition, or is afraid to get care, or has other barriers to engaging in care, that's not going to work. So a more comprehensive, individualized fingerprint approach is needed if you're going to effectively engage people in care.
Okay,
yeah.
For sure. So what are some of the outcomes that you've helped your health plan partners achieve?
Well, there are quite a few. We just recently announced results from a study with one of our large national health plan partners. Okay. What we found there was that the total claims cost went down for the treated group by 42%.
Wow.
Yeah, and the non-treated group went up by about 18%.
Wow.
So that's a 60% difference in total cost of care, and those are largely medical costs that we're talking about there. But Catasys outcomes have been validated at a number of levels. We've had pre-post studies. We've done our partners have done a variety of other more rigorous actuarial type studies to validate our savings and our outcomes.
Okay, very good.
Yeah.
All right, well, that's all the time that we have today, but thank you so much for chatting with me. I appreciate the conversation.
Oh, such a pleasure to talk to you.